Hello, I'm Dr. Howard Kraus, ophthalmic surgeon and CASA board member. I would like to take you on a journey through the first 25 years of the California Ambulatory Surgery Association, CASA. We will hear from just some of the many people who have worked steadfastly in bringing and maintaining CASA at the premier level association organization and achievement. The California Ambulatory Surgery Association is a strong, vibrant organization promoting the advancement of the outpatient surgery center industry. With over 300 members and a robust PAC fund, CASA has become a clear voice in Sacramento and Washington, D.C. Every year, CASA holds one of the most valued ASC conferences in the nation, drawing hundreds of administrators, physicians, nurses, surgical suppliers, and other ASC industry supporters. Most recently, CASA has developed effective relationships with all the major health plans in California, providing a convincing message to the payer that the ASC industry is an essential ingredient for improvement in the cost-effectiveness of healthcare, producing equal or higher quality outcomes at lower risk, greater convenience, and lower cost. Like the ASC industry, the organization we know today as CASA had humble beginnings in the 1980s. Mike Lipome, an ASC pioneer, was the first president of CASA.
So I served the first 2 terms as president of CASA, and now looking at what the organization's grown to today, it's really quite amazing. It's really it's kind of like giving birth to your children. You know, you can't take credit for what they do when they grow up, but you can sure be proud of them.
I was down in San Diego County, and I heard about a meeting that met once a month up in Orange County. And so I drove up there Tuesday night, once a month. I think there had already been a group in Northern California that was putting together several groups, and it kind of all became CASA.
In the beginning, you know, it started off pretty small because it started off with really a lobbying group in Sacramento, and it grew to what was CASA. And then the association started to grow in numbers pretty rapidly as there was a lot of new development back then.
The competition was fierce with the hospitals, and when they did get payer contracts, the managed care payers would put exclusive language in which would prohibit them from contracting with an ancillary service such as a surgery center.
I got into the industry in 1978. Back then, nobody knew what a surgery center was. The insurance companies didn't know what we were. To do a hernia on an outpatient basis was just unheard of.
CASA experienced a membership explosion in the early 1990s, expanding from just 52 members in 1989 to 148 members in 1992. Almost a tripling of membership. By the mid-1990s, the ASC industry experienced significant consolidation. Many surgery centers now look to their corporate partners for support and dropped their membership in our association. By the end of the 1990s, CASA membership had dropped to 40 members, and with only $50,000 left in the bank, survival of the association was in doubt.
In the late 90s, there seemed to be a slowdown, if not a retraction of the number of members in CASA. And as a result of that, we felt that, we weren't sure what was going to happen overall.
CASA did get to about 40 members, and I was one of the 40 members, and I was the treasurer of the organization at the time. Most of us, when we flew to Sacramento for a meeting, our centers, covered everything because the organization couldn't afford. We truly did think it was the end of CASA.
Peggy Wellman's seat came open, and I was asked to come on board and I filled her last year on the board. And yes, absolutely, things were extremely dire at the time. And I remember we were down to our last $50,000 in the bank account.
The CASA board determined that with the organization on the ropes, that a new approach was critical. A 2-day round-the-clock task force worked diligently to reinvent the organization. An executive director was hired, Fran Thompson, and with that leadership, CASA entered the new millennium stronger and ready to grow as it has today.
We had made the decision to hire an executive director, and knowing that we were spending basically the last of our money, and if this didn't work, the association would be defunct, within the year. It was one of the best decisions CASA ever made.
They had the focus group, and it was either, close shop Corps really put all of our investments and energy to moving forward, and they felt the only way to have that happen was to have an executive director.
In 2003, the state of California took on a daunting task to reform the workers' compensation system. The newly reborn CASA was ill-prepared at that time to find its place at the table against the giant lobbying groups representing other industries.
Yeah, the history with workers' compensation and CASA in the state of California going back to the early 2000s was very, very interesting. There was not a fee schedule.
The industry was quickly labeled as being either the gougers or the super gougers in the work comp system.
We got blindsided. We just totally didn't expect to have it come down the way that it did.
But it was almost like there was a perfect storm. We were working hard to eliminate the physician ownership piece that Jackie Spear had put out in a bill, and we were also fighting to eliminate a very low work comp fee schedule based upon Medicare ASC rates.
And a lesson that the association learned was that we should have proactively gone forward to the legislature and proposed an appropriate fee schedule.
What came out of it? A lot. And that a lot of good things came out of it. The membership right after that, I believe, is the year that it doubled or tripled. We had participation by people that we never expected to. It had a lot of positives that came about too.
One of the most vibrant leaders in CASA's history was Richard LeBlanc. From 1997 to 2003, Richard served on the board and for much of that time was our organization's treasurer, contributing strongly to the turnaround and regrowth of CASA.
He became really probably one of the reasons why things really kind of came out of the doldrums, I think, in like 2000, 2001 for CASA, because he had a lot of excitement.
He just had this beautiful relationship with his wife Connie, who he brought to every event. And you know, we worked really hard, but Richard would make sure it was fun. Richard loved to sing. So at every event, and when we were done, we had a serenade by Richard, usually to his wife.
He just brought a joy and an energy to the board. We would not be where we are today without Richard LeBlanc.
And he was just full of life, and nothing was too much. And he had a great memory. He remembered people, and he always was friendly with everyone. He went out of his way to talk to them and to promote CASA. He really believed in it.
Richard LeBlanc passed away on February 10th, 2003, but his contribution to CASA lives on. Today, CASA is an effective, vibrant organization, having become the premier voice of the ASC industry in California. We are now able to provide countless benefits and services to our members.
Centers like GI centers, eye centers, pain centers are very important to the industry. And since the operation of a surgery center has become so much more complex because of the infection control requirements, the Medicare conditions for coverage, because of human resources and labor laws, just managing the finances, all of this has to fall onto that center and their operations. And I believe CASA can provide a significant amount of value to those centers.
No one has reached out to the health plans like we have with CASA as to build relationships on behalf of our members, represent our members' needs, and also find out what their needs are, what they're looking for from the surgery center business.
I think the organization is to a point where it's a huge benefit for any surgery center to be a part of CASA, and I say that for a couple of reasons. There's tools and resources available that you just simply don't have as a standalone center. It's very, very common for us to face issues at a local level that have already been faced somewhere else.
I think one of the biggest benefits of being a CASA member, this year I participated in the EMS disaster preparedness. So getting out there and doing the quarterly meetings with Beth, I realized that there are a lot of ASCs out there that really need those resources, and we were able to provide them that information and get them through that scary CMS survey.
At the time of this video, we're faced yet with another challenge in Sacramento. There's a workers' comp piece of legislation that has been negotiated behind closed doors. Has surfaced in the last 2 weeks. We don't really know what the outcome will be at this point, but the one thing that I feel very good about is, and impressed with, is how quickly the CASA resources came into play, how quick, within hours, literally hours, our friends in Sacramento, the legislature, and even in the governor's office understood our message, understood that there was things that needed to be tweaked in the legislation, and went to work on our behalf. Another thing that happened, which didn't happen 10 years ago, was that our national organization, ASCA, stepped in within hours to help out. It's the first time that I've ever seen that happen, and it's, to me, shows the strength of our ASC industry nationally and within the state.
CASA A provides mentorship for younger, newer leaders into the organization through people that have been in the industry for many years, and specifically in the state of California. I think for any new leader, whether you're 20 or 50, it's a great opportunity to learn from maybe the mistakes and challenges that people have faced, and have them pay the price of tuition, and us get the education for free.
CASA is always my favorite conferences in the whole year. We always have great locations. We've been to Monterey, we've been here in Monarch Beach at the St. Regis, and just the networking and the quality of the program is always spectacular. I mean, I come all the way out here from New Jersey.
I think being an executive director at an independent surgery center, sometimes you can feel isolated, and it's difficult to be able to know what else is going on in other centers. And sometimes you can call and you can get to some sort of communication, but it's a lot different to actually sit around a table with peers for 2 or 3 days, and maybe sharing a dinner or a lunch, and then also being able to attend to kind of like going back to school. So one of the things I really enjoy about CASA is the level of conference, the speakers that they get. It really furthers my knowledge, so when I go back to my little silo and isolated surgery center, I come back armed with a lot of information and feel better prepared to do my job.
Shows and meetings can be a little redundant, a lot of standing around time, a lot of handshaking and people passing by, but CASA is completely different. The people that are in attendance not only are interested in seeing the vendors instead of just blowing through, picking up their certificates and leaving, they actually come, shake hands, ask questions, engage, they thank.
I've picked up a lot of good information that maybe it wasn't something I needed today, but then it's like, wow, I could use that product in my facility now, because you know all of our facilities change from day to day. Sometimes just our procedures change, or what products we need, or a physician says, hey, I heard about this, and you saw it at CASA.
I really do enjoy the educational sessions. I think we have great speakers, very informative, and with the increased regulations that we've had over the last couple of years for surgery centers, I feel like it is more necessary than it's ever been.
A huge networking opportunity during the annual conferences, the regional conferences, benchmarking, guidance, and just any time someone has a question. It's so easy to pick up the phone, contact Beth, or any of the board members, or anyone involved. So there's so many resources available through CASA.
Improvements in anesthesia and outpatient surgery in general are going to make for bigger and bigger industry of outpatient services, total joint, spine, a variety of general surgical cases, head and neck cases. A lot of that stuff that's not being done in surgery centers now will be done in surgery centers for certain in the future. And this generation, myself included, should be the ones who try to take the surgery centers to that next level. And that will be a way that healthcare itself is going to be greatly improved.
CASA needs to be there not only to serve as the substrate of uniting our efforts in the ASC industry, but also to provide the necessary information to legislators and regulators and other people who may be making healthcare decisions so that they're not swayed to a false position by incomplete presentation of information by another party. So without CASA, the strength and viability of the ASC industry in this state is threatened. With CASA, I think it has a very bright future. CASA's heritage is strong, and its proud success is a product of the hard work and determination of many. But the next 25 years, the future of CASA will be the responsibility of the next generation of ASC leaders. Some of our future members and leaders have just watched this video, a production which has been made to celebrate our first 25 years and to launch the next 25. Thank you for sharing our past, present, and future.
CASA, 25 great years. Happy birthday.
Happy 25th, CASA. Happy 25th birthday, CASA, from McKesson.
Happy 25th birthday, CASA. Keep up the good work.